Hello and welcome to this video on pneumonia. So what is pneumonia? Pneumonia essentially means it is an infection of the lung parenchyma, and parenchyma essentially means tissue. So let's think of it as an infection of the lungs. If we bring up a diagram, such as these pair of lungs here, let's talk about the normal physiology. So when you take a deep breath in, with this blue highlighter representing the oxygen that comes in through the trachea, the bronchus, and then the bronchioles, and eventually reaches towards the alveolar sacs. And the opposite happens essentially with carbon dioxide. We breathe it out. Let's imagine what happens in pneumonia. If we inhale something, for example, Streptococcus pneumoniae, a microorganism, and it gets trapped in one of the bronchioles, as you can see here, it causes inflammation from the body, and that's the body's response to an infection. Therefore, you get a buildup of fluid, fibrin, and neutrophils, otherwise known as exudate, within the alveolar sacs, and this causes essentially a pneumonia. Let's talk about some of the types of pneumonia. There are 4 types that we need to remember. The first one we're going to talk about is something called community-acquired pneumonia. This is an important one to remember, and it essentially means anyone within the community, or essentially outside of hospital. There are a few organisms that we need to remember. The first and most important is Streptococcus pneumoniae. This is the cause of typical pneumonia, so make sure you remember this. Some other causes can include Haemophilus influenzae, sometimes also Legionella, and even Mycoplasma pneumoniae. Now let's talk about the second type. This is hospital-acquired pneumonia, and this can be simplified as HAP. You may hear this on the wards. It essentially means anybody that gets a pneumonia within the hospital, and the definition is when you acquire a pneumonia 2 days after admission. Important things to remember are the majority of these pneumonias are caused by gram-negative organisms, such as E. coli and Klebsiella. The third type of pneumonia that we're going to talk about is something called an aspiration pneumonia. And that's what it means. It means when you aspirate something within your lungs. Most commonly, as this diagram shows, it's gastric contents. So it's important to bear this in mind, for example, with patients who are at high risk of aspiration. This includes intoxicated patients, importantly stroke patients or those with bulbar palsies who have unsafe swallows and therefore contents may enter into the lungs, or those with esophageal disease. The last type of pneumonia we're going to talk about is something called an immunocompromised pneumonia, and it essentially means exactly that. It's with patients who are slightly less immunocompetent and therefore more prone to infections, such as normal organisms, as we mentioned, strep pneumonia causing a severe pneumonia, or those less virulent organisms. This includes fungi, for example, Candida or Aspergillus, and also Mycobacterium, and sometimes even viruses such as cytomegalovirus. So now we know a bit about how pneumonia actually comes about. Let's think about some of the clinical features. So here we have our virtual patient. What sort of symptoms will he be exhibiting? So the first thing with pneumonia is a cough. So you always want to ask whether the patient has had a cough. And in particular, you want to ask whether there's any green sputum. And that suggests that there's an infective pussy process going on in the lungs. You can also ask a bit about pleuritic chest pain. Does the patient have any pain when they take a deep breath in? And this will also help you with your differential diagnosis, for example, any cardiac causes. And also, there will be some shortness of breath because they're trying to get in more oxygen to meet their demands. In addition to these symptoms, you also want to ask about some constitutional symptoms. Remember, it's an inflammatory response, so there will be some systemic effects such as fever and fatigue. So once you've asked about those symptoms, you want to think about other more malignant causes such as cancer. So if we draw a bit of more structure to the lungs here, so we have the end alveoli here with the bronchioles. Imagine you have a cancer of the lung. A lung cancer, seen by the red colouring there. That can press on the bronchus, and that can cause infection in the distal alveoli, so that can cause similar features to the pneumonia. In addition to those symptoms, you want to ask about the more important symptoms, such as weight loss, hemoptysis, which essentially means any blood when you're coughing, so make sure to ask that. And how long has the cough been going for? Is it a long-term cough? And then acquire a sort of smoking history. That is a risk factor for lung cancer. Imagine we have the patient here, and we have all of these alveoli which are filled with exudate, and their gas exchange is very poor. So you get all of this pus within this zone of the lung, which affects the perfusion to the body. Therefore, you'll get some peripheral cyanosis, as you can see I'm drawing here, and also some central cyanosis, so make sure to look at their tongue. In more severe cases, this may even affect the blood supply towards the brain, as you can see here, as well as the kidneys. Hence, it's extremely important that you ask about septic features. Is the patient hypertensive? So you check the blood pressure. Are they very tachycardic? Do they have a prolonged fever? Is there evidence of the organ failure that we've just mentioned? Because if there is, then this patient is very sick and they may even need intensive care. So finally, let's move on to the examination findings. When you percuss the chest, so that's when you tap the chest over the affected region because of the exudative consolidation, there will be a dullness to percussion. There will also be a decrease in air entry, for example, the air is not able to reach the entirety of the lung. And then there will be an increase in vocal resonance, so for example, when you get the patient to say 99, and this is more clear because of the exudate. And finally, you may also hear some crackles due to the fluid that is present. Okay, so let's talk briefly about some common organisms that we may encounter in examinations. The first is Klebsiella. So as you can see by the picture here, you need to think about alcoholics. It's very common in them. And the clinical features it presents with is essentially upper lobe cavitations, current sputum, and lobar pneumonia. You can see on the diagram here that essentially means affecting one lobe. And you can also see that the cavitations will be affecting the upper lobes. Next we have Chlamydia psittaci. It's always important to ask about birds in your history. Birds or parrots, as you can see here. And the sort of symptoms you'll get are meningitic symptoms. Next we have Legionella. For Legionella, the history that you want to take is regarding travel or any contact with any infected waters. Also taking good smoking history. The symptoms are quite specific in Legionella, and these are things you need to remember. So, flu-like symptoms, think about water and flu being related, hyponatremia, and lymphopenia. So this brings us on nicely to investigations. The first thing you want to do when you see a patient who has potentially a pneumonia is do a Curb 65 score. And you can see this by looking at this here. I'll leave it up in the corner so you can have a read. But it's essentially something that you need to learn. So if we move on to some of the bloods that we need to take, you want to take a full blood count. You want to take UNEs, and you want to look at CRP. And CRP is an acute marker of inflammation. And you can see from the diagram that there is going to be an inflammatory exudate, as we mentioned earlier. So you can also do some blood cultures as well to help try identify the organism. The ABG will also show that you'll have a decrease in oxygen and increase in CO2. As you can see from the diagram, you're not getting that perfusion. In addition to this, you'll also be able to find the lactate on the ABG, which may indicate a septic picture. So let's move on to the urine. As you can see here, you can get some urinary antigens by just taking a simple urine sample. And the two ones that you can do are Streptococcus pneumoniae and Legionella. So let's think about sputum. So here you can see the infection, and you can see that the pussy exudate is essentially going to be coughed up, quite green, and you can do culture of that. So in terms of an X-ray, we can also do an X-ray because we can see the consolidation in the exudate, and essentially that section there, which is full of pus, will show up on the X-ray just like this. So if we diagrammatically try to see that, you can see here, here's all the exudate and the infection, and underneath in the X-ray, you'll see that there's some slight consolidation in that lower zone. In terms of management of pneumonia, we want to take an ABCDE approach. And this is important because this could be a potentially sick patient. So once you've done this systematically, think about various factors such as hypoxia. Are they hypoxic? Do they look slightly pale? Are they struggling to breathe? Then you may want to consider oxygen, potentially a 15 liters non-rebid mask. Also, what's their fluid status like? Have they got a decreased urine output? Are they looking pale? Are they looking dry? So you may want to consider some fluids such as 500 ml stat dose. In terms of the pneumonia itself, we won't go into the details of antibiotics because different hospitals have different guidelines. But just remember, it's an infection, so you will treat it with antibiotics. And the majority are caused by Streptococcus pneumoniae, and therefore amoxicillin is a good antibiotic. But it's important to check local guidelines. Okay, great. So we've been through pneumonia. Let's do a quick summary. So pneumonia is essentially an infection of the lung parenchyma. And the four main types of pneumonia that we need to remember are hospital, community, aspiration, and immunocompromised pneumonia. In terms of the clinical features, make sure to remember a cough that is productive of greeny sputum, fever, and shortness of breath, and maybe some chest pain. Make sure you do not forget to rule out sepsis. In terms of investigations, we mentioned we can do a urine sample, some blood tests, and X-ray. Management is going to be with antibiotics, but if they are septic and quite poorly, you will consider oxygen and fluids. Thank you for watching.